Good morning, ladies and gentlemen. Let me introduce myself once again. I am Colonel Dariusz Dobroń, and I am Chief of Transformation Branch in our Center of Excellence. But today I have a pleasure to moderate a couple of panels which are in front of us, starting with the current one. The repercussions from the COVID-19 pandemic are far-ranging and affecting as well single individuals as whole society. Important role in fighting with this crisis are on our shoulders or shoulders of national and international institutions. One of them is, of course, NATO. So we are going to discuss how COVID-19 could influence the way we think about future international missions. Our first briefer is one of the best in that field. So let me present Mr. Kyle King, the founder and managing director of Capacity Building International. He spent 28 years in the emergency services and international security field, which 8 of those years being with NATO. He has worked in missions includes Bosnia, Afghanistan, and Kosovo. And now, if I am not mistaken, he is in the Ukraine. So Kyle, nice to have you here, and over to you.
Hi, thank you very much. It's a pleasure to be here. Good morning to everybody, and I hope you're doing well in this quarantined environment. I really appreciate the time to be here with the CMDR COE, and we'll just go ahead and get started on the presentation. So what I wanted to talk to you today was, and just brief in some experiences about the impacts of COVID in future missions and security assistance. Now, one of the challenges here is not only are we all dealing with this issue ourselves in our own countries, but also from the fact that we need to think about what the impact this has on our missions. So this is slightly different from some of the other presentations where we talk about the national response component, and we're going to be talking about the missions themselves as they operate. As previously mentioned, my background is in emergency services itself, instructor, inspector, and chief fire officer, and I spent about 20 years in emergency services, but more importantly, most of those years were spent internationally between Bosnia, Kosovo, Afghanistan, and Ukraine, where I am currently in Ukraine now. What we're seeing here now, this is my point of view from missions in other countries. Again, we're talking about host nation support to missions and then also partner countries. And what we're seeing as far as the impacts of COVID-19 in the missions are that we're seeing overwhelmed host nation support. Now, this is not a shock. This is not a surprise. Many of our own countries are completely overwhelmed. But the context here is a little bit different because of the fact that we now have a mission which is embedded in or living inside of another nation. And we are now surveying across the landscape of all the institutions. And what we're seeing is that the systems are taxed and they're overwhelmed. We're seeing that there's disaggregated host nation system development, which simply means all the institutions where we are operating in for those countries have different levels of development. So the police are at one level, the fire brigades are at one level, that public health care system is at another level. Now, collectively, what that means is that there is an increased vulnerability to NATO and the international organizations due to this collapsing systems and support structures. So once the public health care system fails or is maxed out in one country that we are operating in, that simply means that we can no longer rely on that host nation support for our own purposes as a mission. That increases our risk, our exposure as NATO, as an international organization, and also is something that we have to contend with and plan for. What we're also seeing, and this is really quite unique, is we're seeing the exploitation of quarantine measures. So we're seeing armed forces or uniformed forces that are actually putting up checkpoints as temperature control points. We're getting restricted freedom of movement due to quarantine measures. And we're also getting the effects of, say, isolation. If you move into one area, then you have to quarantine inside that area for 2 weeks or be in self-isolation before you can actually go anywhere. Or, our interlocutors are not available for us to talk to. How can we engage as an international mission with the host nation if everybody's in quarantined and restricted? So these are some of the things that we are seeing. We're also seeing active disinformation and misinformation campaigns to undermine the national and international efforts, both in terms of credibility and in capacity. And we're seeing insufficient interagency cooperation and national planning frameworks. Now, again, we could easily look at our own countries and say there's not enough coordination and things should be better. But when we are, again, from the perspective of an international mission and we're looking at the host nation and we're seeing this insufficient cooperation and national planning framework and response mechanisms can be a cause of concern for us because we are, reliant on some of these systems. And we're also seeing a disruption in supply chains. Now, this is something that was really unique, but as a mission in another country, you are also going through the standard procurement procedures. You are reliant upon the host nation that you're in for, logistics and materials and supply chains, just like everybody else. And so now the international mission themselves, as an entity, is becoming a competitor in the market for things as simple as masks. And that's driving some complications in our procurement procedures as well. So looking forward, how can we actually increase our partner or host nation capacity after this kind of COVID-19 experience? Ideally, and it has been for years, we've been talking about a comprehensive approach. But I think that the reality is, the practical reality is on the ground, is that we still really have what I call pillars of development, which basically means that all the international organizations, let's just focus on the big four, NATO, EU, OSCE, and UN, we all have different views on what development looks like. We all have different resources and different assistance mechanisms and packages that we can deliver to a host nation or partner nation in order to increase their security and their stability. That might be focused on education, that might be focused on the security forces, or that might be focused on rule of law, governance, elections, whatever the case is. But how often are these actually synchronized? How often are they actually integrated? And how often are they actually working together to achieve stability? Now, what we often say is that resilience is a national responsibility. But who actually helps build resilience? Now, in the future, we should, after this experience, we should really become an advocate for resilience. As international organizations, we need to promote things like interagency cooperation, which, yes, it is a national responsibility, but we need to really begin having that discussion about what that means, as well as crisis management, emergency management, disaster response planning very early on into our security assistance efforts. And the early integration of these lessons learned, what we're learning now for our own nations from this experience, we need to move that into the future security assistance programs and help address some of the shortfalls that we already know and we already have evidence of happening. And what we need to do to improve that process is we need to recognize that civil preparedness, emergency management, is a key component of stable societies. It is something that needs to occur to be able to respond to and effectively deal with a crisis. We need to acknowledge the missions eventually evolve into this discussion about resiliency. And I'll provide an example later on in another slide. But this occurs as a natural progression of stability. We build the institutions, they become functional, we train, we equip, we mentor, we advise, and then we start discussing the whole of government response. Now, if we call it that or not, that's a different discussion, but we do focus on interoperability. We need to take stock of existing means and capabilities. What are we currently doing? Because this is not going to be something that requires a resource-intensive program, but it is something that we have a lot of time and effort spent on, especially in NATO over the years. In Emergency Planning Committee, EADRCC, or colleagues that will be briefing later, CIVPREP, and especially the CMDR COE and EU civil protection mechanisms and Science for Peace programs. All these tools and mechanisms exist out there and can be leveraged to improve our security assistance and our ability to promote emergency management or crisis management as a tool for stability. I would also argue that we need to have early integration of emergency management and crisis management into our operations, into our security sector reform. And again, it will happen anyway. We need to acknowledge this. So why not start early on? When we start the reform programs and we start building capacity in other countries, we should have a discussion from the very beginning about how you function and work together collectively with the other security sector actors. In addition, we can leverage bilateral programs like the Civil Military Emergency Preparedness Program from the United States to support international efforts. We can coordinate our security assistance programs to include bilateral partner programs and other initiatives, because just because we can do it doesn't mean we should, and doesn't mean that we have to. There are other agencies, there's other bilateral partners and other security assistance programs that may be better resourced and capable of delivering the type of tools and advice that we need. So all of that together, here's an example that I like to highlight, which is that there's a Silver Sabre exercise that's occurred in KFOR every year, and it's part of the headquarters KFOR and the overall KFOR mission element. And the history of this exercise was that it was specifically focused on crowd and riot control in the initial beginning and host nation police capacity. And it focused on the interoperability between NATO forces on the ground and host nation police. And now this eventually evolved to include security forces. And every year it's been an expansion upon the existing program to where it includes disaster management, topics like emergency preparedness and interagency coordination, or what they're calling interoperability. The key point here is that this is becoming an end state, and resiliency and emergency management and crisis management is becoming an end state for many of our missions to have effective and stable societies so that we may be able to leave those nations and basically have quote unquote a mission complete status. So the key point here is with that end state in mind, let's go ahead and start integrating this into our missions and our security assistance programs as a direct way and method to promote resiliency from the beginning. And that's my key message for today is that, taking all these wonderful lessons learned that we're hearing about and everything from the conference today, and really start forward thinking and recognizing that this needs to be an active program that we need to promote. And so with that, I just thank you for your time today, and especially to the COE for allowing me to share my thoughts and my views, and I remain available for any questions that you might
have. Thank you very much, Kyle, for your comprehensive presentation and good information. Let me ask you one question. You said that resilience is a national responsibility, which is, of course, is true. But sometimes this resilience pending the international assistance. How restrictions implemented by some countries can prevent this assistance? Could you elaborate this?
Could you repeat the second part of that question?
Okay, once again, how restrictions implemented by countries could prevent the international assistance?
Oh, definitely. So one example I'll just use from the exact experience that we're seeing today is that the restrictions on flights and the border restrictions are affecting international assistance greatly. It's affecting the ability of international personnel to be able to get in and out of countries, to travel without restrictions. And this is largely worldwide. But for the missions themselves, it's affecting the logistics and procurement supply chains. It's affecting the ability to move personnel in and out of countries, just logistically speaking, because of flights, because of border controls and things like that. There's also the issue of needing to have medical clearances, the testings. Everybody had been struggling in the past with getting COVID tests into the theater of operations, and it took some time to get those in place. And then also, I would add that the medical evacuation piece, that's also another component. If we're doing an international medical evacuation, how can we get our personnel outside of a country under these current restrictions where there may be no pilots, there may be no aircraft, and these kind of situations. As far as the delivery of security assistance into the country, that's all essentially been largely shut down. Everything has gone virtual, and the restrictions are impacting all of the operations to a great extent. I hope that answers your question.
Certainly, yes. Thank you very much, Kyle, for your intervention. Keep safe in Ukraine. And another question which we'll receive for you, we will pass it to you and try to then answer at the end of the today's conference when we will do the summary. Before we move to our next speakers, let me make a short reminder for all who are watching us on YouTube. You can populate your question using the chat on the right side, or use our application on our website, our applet called